Hello, I hope you are doing well. I am Dr. Mateus, and today our lecture will be about Reiki. These are my conflicts of interest. I don't have any conflicts of financial or professional nature. I am a Reiki practitioner, but I do not practice it professionally. But keep that in mind as I go along the presentation. Well, our objective today will not to describe all the aspects of Reiki, but to have an overview of what the scientific literature has to say about it. So, to make sure we are all beginning at the same page, let's talk a little bit about Reiki. Well, Reiki was founded, let's say, by Dr. Mikao Usui. The practice began at the beginning of the 20th century in Japan. It was very localized in the first few years, but over time new practitioners spread the practice of Reiki to many countries. The fundamental principle of Reiki is that the practitioner serves as a channel, allowing the energy to flow towards the receiver or the patient. The practitioner does not generate the energy. It does not come from him. The practitioner is a channel. One important thing to note is that Reiki is not affiliated with any religion. And Reiki is applied in sessions in which the transmission of energy is made by the imposing of hands. It can be made with direct touch, with the hands of the practitioner near the skin of the receiver, or it can even be made at a distance. We'll talk a little bit more about that later on in the presentation. So why talk about Reiki? First point is that there is a growing interest in research about this topic. A search for Reiki in PubMed on the beginning of July of 2024, which is the month this presentation is being recorded, had 3,640 results, with a tendency of a growing number of studies per year. The second point is that Reiki is a simple and accessible methodology, tool, practice, whichever word you prefer. But being simple and accessible are both very good qualities when we think about a tool for healthcare. And the third point is that there is a growing number of institutes and providers and people in general adopting Reiki as a practice or as a resource for the improvement of other people. Talking a little bit more about the adoption of the practice, there are many institutions, very respectable institutions, if I may say, in the United States that already use Reiki in their roster of options for treatment of patients. There are a lot of other institutions around the world. Here in Brazil, I can specifically say about the Hospital das Clínicas da USP de Ribeirão Preto, which is a very famous university here in Brazil. It's one of the most notorious examples, but Reiki is being adopted in many other services. One of the reasons of that, particularly here in Brazil, is because Reiki is included in the National Policy of Integrative and Complementary Practices of the Ministry of Health. So in some places it is being offered, among other therapies, on the Universal Health System that we call SUS. There are many organizations that already recognize Reiki as a practice. It is recognized as a complementary health practice by the World Health Organization and the Pan American Health Organization. And there are some organizations, some institutes that try to stimulate the training of individuals and more scientifically rigorous research about this topic. And it's growing popularity. Here I selected a few publications from public media, but there are many practitioners in many countries. We will see here articles from the United States, from Brazil, from Turkey, from Japan, from a lot of places. Okay, that's all good and well, but what is the scientific evidence of Reiki? Well, let's begin with preclinical studies. Preclinical studies are studies that try to find the most fundamental effects of the thing we want to research. Most of the time, they are the studies made in laboratories. So, here we have two studies. For those who are not from the healthcare profession, here we have the titles of the studies, we have the authors, we have the journals in which they were published, the year they were published. If you search the titles, you can easily find them and read them yourselves. Most of them are open access. Some of them are not open access, but you can at least read the abstract. Well, let's begin with the study on the left of the screen. This study doesn't talk about Reiki specifically. It talks about biofield practices. Biofield practices is a group of practices in which Reiki is included in most of the scientific publications. It is considered a type of biofield practice. And I have selected a passage of this text that is very interesting. It says, several authors have studied the physical effects of intention. The results of those experiments could even indicate that human intentions would remotely influence cellular function, microbial growth, the growth of tumors in animals, the germination of seeds, the growth of plants, the healing of surgical wounds in animals, the kinetics of biochemical reactions, and have significant effects on non-biological settings. Let's take a look at the study here on the right of the screen. This was a study that evaluated the effect of applying a biofield treatment. It doesn't clearly say if it was Reiki or other kind of biofield treatment. It just refers to the practitioner who performed the treatment, but it considers it a biofield treatment in normal brain cells and in brain tumor cells. So this study divided these cells in two groups. There was the group that received biofield treatment, both normal brain cells and the brain tumor cells. And there was the other group that did not receive this treatment. That was the control group. And they evaluated the changes in the behavior of mainly cell death, the speed in which cells from each sample died. To the people that are not in the healthcare profession and have never seen a brain tumor, I'm about to show an MRI, a brain scan, showing the appearance, a typical appearance of this type of brain tumor, glioblastoma, of which the cells were used in this experiment. If you are sensitive, you can jump this part. So pause the video right now. I'm about to show the image. Let's go. So here we can see an MRI. On the bottom right of the screen, we can see this lesion. It's a very big lesion. It has this edema around it. It's a typical appearance of a glioblastoma, but glioblastomas are a group of tumors. There are many types of glioblastomas and they can have different appearances. This was just to illustrate. Back to the study. So, what did they find in the results? Well, they found that the group that received biofield therapy had a different behavior in terms of cell death compared with the control group. In the group of cells that received biofield therapy, the normal brain cells had a slower rate of cell death. That means the biofield therapy had a protective effect on the normal brain cells. However, in the glioblastoma or in the brain tumor cells, there was an increase in cell death. That is very interesting because it shows that there is evidence of a physical effect, and the effect was different based on the nature, let's say, of the cell. That's a very interesting observation. This one was also a very interesting study. The researchers took cells from the intervertebral discs. The intervertebral discs are the discs in our vertebral column that serve to give mobility and protect it from load, stress, those kinds of things. Well, they took these cells and they separated them in two groups. The first group received Reiki. This was an experiment that used Reiki, and the other group received sham Reiki, false Reiki. That's important because not so much with cells that in principle are not conscious entities, but when you're dealing, especially with people, when you're studying something that is more practical than medication, which you give by a pill, for example, when you try to eliminate or minimize the placebo effect, you have to use a placebo that is more similar to the real thing. That is what sham Reiki or false Reiki is. So they took these cells, divided them into groups. One received real Reiki, the other received sham Reiki, and what did they find? Well, first let's take a look at this picture right here in the bottom left of the screen. In blue, we have the cells that received real Reiki. In red, we have the cells that received false Reiki. The first thing they analyzed was the emission of biophotons. We know that living cells, living tissues, living organisms, they emit light, they emit photons. And there was a difference in the emission of photons in the group that received Reiki compared to the group that received sham Reiki. And that was maintained along the 3 days of the experiment. Now let's take a look at the right of the screen. Here we have the concentration of certain molecule substances, both in the cells that were subjected to Reiki and the ones that were subjected to sham Reiki. And they found that there was a difference in the amount of type 2 collagen and aggregans that were increased in the cells that were exposed to real Reiki compared with the cells that received false Reiki. And these two molecules are involved in the anabolic healing response. So it suggests a beneficial effect. Here we have two studies that evaluated the physical effects of Reiki in laboratory rats. They were made by the same research group. The study on the left was published in 2008. The study on the right in 2006. But they have some differences. Let's begin with the study on the left. In this study, they took 3 rats. They exposed these rats to noise, a specific type of noise that is very disturbing to them. These rats received real Reiki for a few days, and after a few days, the same rats exposed to noise again received sham Reiki. They were interested in seeing the effects on heart rate, blood pressure, and they found a difference. They found that when the rats received real Reiki, they had a significantly reduced increase in heart rate compared to when the same rats received false Reiki, suggesting that the rats experienced a smaller stress disturbance when exposed to the noise and receiving real Reiki. Now let's take a look into the study of the right of the screen. Here they had laboratory rats. They separated these rats in two groups. They separated the rats in 4 groups. One group was the control group, was not exposed to anything, nor did it receive any treatment. The other 3 groups were exposed to noise. One group that was exposed to noise did not receive any treatment. One group that was exposed to noise received sham Reiki. And the last group that was exposed to noise received real Reiki. And what did they found? They found that these rats, when exposed to high levels of noise, they suffered damage to microscopic blood vessels in their intestines. We call that the mesenteric microvasculature. And they found that the group of rats that received true Reiki had significantly less microvasculature damage when compared to the other groups. Okay, so now let's begin talking about some studies in humans. In this section of the lecture, we're going to take a look at case reports and case series. Case series is when, for those who are not from the healthcare sector, it's when they publish information about a group of people, and a case report usually is one or just a few individuals. Alright, let's begin with a very rich report. This was the report of a single patient. He was 54 years old. He had hepatitis C. He had already tried the typical treatment, but it was not successful. He had other diseases. He had obesity, he had metabolic syndrome, he had asthma, and he had hypertension. Well, he was initiated on an experimental treatment with high dose of medications, but this treatment had side effects. The main side effect we are interested here is that the experimental treatment reduced white blood cell counts, both total white blood cell counts and specifically the neutrophils. If this reduction was too intense, it would require the treatment to be interrupted. Well, as the patient was receiving the treatment, he wasn't feeling very well, and one of the doctors that was following up on his case was a Brazilian spiritist doctor who offered to him what is called a passe, a spiritist passe. It's a religious ceremony from the spiritist religion, similar to many other kinds of ceremonies of many other religions, that seeks to be of benefit to the receiver, usually by serving as some way of transmitting good energy or beneficial energies. Well, the patient did feel a bit better, but what did they observe? They observed that after the passe, the blood cell counts increased. So they had an idea. Since the patient had a response in his blood cell counts with the spiritist passe, they tried to use Reiki to achieve the same thing. So, let's take a look at this picture right here. Here we see the blood cell counts of the patient. The dark gray is the total white cell count, and the slightly lighter gray is the neutrophil counts. So the patient started the treatment right here. The patient started the treatment right here, and as the treatment went on, his cell counts dropped. He then received the spiritist passe, and his blood cell count increased a little bit. Well, the patient continued the treatment for a few weeks. His cell counts tended to lower again, and then he received his first Reiki session. He received a total of 5 Reiki sessions, and what they noticed was that after each Reiki session, there was an increase in both total white cell count and neutrophil counts. Here we have the increase after the first session. Here we have the increase after the second session, after the third session, after the fourth section, and after the fifth section. But that was not all. After all this happened, there was a certain time when the patient participated in a meeting with untrained individuals who experimented to try to send him good energies, let's say, by laying on hands without any special training for that. And when he was exposed to these untrained individuals, there was not the same response in cell counts, meaning that there was a difference between the laying of hands by untrained individual, laying on hands, not of hands, laying on hands of untrained individuals compared to both Reiki by a trained practitioner and the spiritist passe. But that was not all. They also used a random number generator to observe the effects of these interventions. Well, let's talk a little bit about how this random number generator works. Well, these apparatus generated random numbers. So here, let's take a look here at this picture on the left. We have this horizontal line and we have this dark line. This dark line is the behavior of the generation of numbers. The closer this line is to the central line, the more random, let's say, the generation is. When this dark line goes away from the central horizontal line, the generation of numbers is less random. It is pointing in a direction. This image on the left is a sample from our random number generations on a typical working hour of that institution. Now let's take a look here to this column on the right. This is a modified figure from the article. It is modified because I couldn't fit the entire figure here, and I put these markings here. These are the images of the generation from the random number generator inside the office of the Reiki practitioner. This darker space is the random number generation before the application of Reiki started, and this lighter colored space is the behavior of the random number generator during the application of Reiki. And what they observed that the random number generator had a different behavior inside the office of the Reiki practitioner even when Reiki was not being applied, compared to a sample on other spaces of the same institution. And they also observed that during the application of Reiki, the random number generator behaved markedly different from its usual state in the same room. They also observed, I'm not showing that here, but they also observed that when the patient was exposed to the laying of hands by untrained individuals, there was not this difference in behavior from the random number generator, suggesting that Reiki somehow affected the behavior of the generation of random numbers. Meaning that, in some sense, they may not be so random at all, or at least it is a process that can be influenced. Now we have another very interesting study. This was a study, a case series of patients that have refractory seizures, refractory epilepsy. Those were patients that were already taking a lot of medication, but still did not have adequate control of their condition. So these were patients with refractory seizures that were already taking at least 3 anti-epileptic drugs on full dose and good adherence. The subjects did not receive just Reiki, they received Reiki and transcendental meditation. And the researchers measured seizure frequency before and after the intervention, and levels of neurotransmitters and some molecules that are of interest to adequate neuronal function, including magnesium, digoxin, among others, such as the sodium-potassium ATPase enzyme, some biological structures that are relevant to neurological function. Well, what did they found? Let's take a look here at table 3 on the left. This is the seizure frequency before the intervention, the therapy, and after the intervention. And we can see that to these patients there was a very significant reduction in the frequency of seizures. There was even a patient that during the period in which he was followed up for this study, he did not have more seizures, and it was a female patient, she was having 9 seizures per month before, so that's very significant. But there was also a change on the biological markers of neuronal activity, suggesting that yes, there was both clinical and biological effects of this intervention with Reiki and transcendental meditation. Let's take a look at this study here on the left. Here we have a study that studied the subjects with electroencephalogram. They studied electrical brain activity. So they had the patients, the subjects of the study, they had the Reiki expert, and they had an untrained or not as experienced individual. So they measured the electrical activity of the brains of both the person that was applying either Reiki or the novice practitioners, and the person receiving the intervention. And they observed that there was coherence. Coherence is, in lay terms, synchronization, harmonies of the electrical brain activities of segments of some parts of the electrical activity of the brain between the Reiki practitioner and the person receiving it during the application. And that did not happen to the inexperienced, the novice practitioner. They did not specifically say if it was a novice Reiki practitioner or if it was an untrained individual that was just shown how to mimic the movements that are made during a Reiki session. But they did find that for the experienced practitioner, there was this effect on brain activity between the practitioner and the person receiving Reiki. This study here on the right was a study that was performed on a facility that cared for people related to the military, and this was a case series of 30 patients, or let's say 30 military healthcare beneficiaries with chronic pain. They received Reiki. There was not a control group. This study just describes the effect of this intervention in these people. And what they found was a beneficial effect on the reduction of pain. So let's say there was a significant decrease in pain. There was a beneficial effect on general activity, walking, relationships, sleep, enjoyment of life, and a reduction of stress. And overall, there was a very positive impression of the participants regarding Reiki, and that they would consider maintaining these therapies. This study here on the left was a very similar study, but for patients on hemodialysis. So this was a study with 15 patients who received Reiki, and they were mainly focused on pain, and there was a beneficial effect on the relief of pain on these individuals. This study here on the right is another case series with children suffering with cerebral palsy. There were 13 pediatric participants, and the main result of this study is that there was a decrease in pain when they were lying down. They did not find that while the patients were sitting, and there was a trend of benefit in anger symptoms on these patients. So they finished the study saying that these preliminary results are encouraging and more studies should be conducted. We are gonna hear this phrase a lot during these presentations, and when you read papers about complementary therapies such as Reiki and many others. This study here on the left was a study to evaluate the effect of Reiki on 23 essentially healthy individuals, and what they found was that comparing before and after receiving Reiki, anxiety in these individuals was significantly reduced. The salivary immunoglobulin A levels rose significantly. Immunoglobulin A in the saliva is very important to maintain a control of the microbiome in our mouths. So this is an encouraging result. There was a significant drop in systolic blood pressure, which suggests a relaxing effect. And there were also some effects observed in skin temperature and electrical and muscular activity during the treatment. This study here on the right was a large case series with 99 Reiki practitioners across the United States who invited their clients to participate in the survey. So the clients that agreed to participate answered the survey before the application of Reiki and after the application of Reiki with their practitioner. There were a total of, let's see here, 1,411 Reiki sessions recorded. The analysis. There were beneficial effects for all outcome measures in this study, including positive effect, negative effect, that means a benefit on emotions, both positive and negative emotions, a benefit on pain, on drowsiness, tiredness, nausea, appetite, shortness of breath, anxiety, depression, and overall well-being. This study has a limitation that although it has a large sample size, there might be some confusion because the Reiki practitioners invited their clients to participate in their survey. They answered the survey right before and after the application of Reiki, so that might contribute in some sort of way to this perception of benefits from these patients. We are going to look at some other studies as the lecture goes on that tries to isolate this effect, to take a look at the effect of Reiki as objectively as possible. So we are entering this session of the lecture and we're going to take a look at clinical trials. Right now we're going to look at clinical trials that used placebo or control groups. They were not specific. They did not mimic Reiki. They did not use sham Reiki or false Reiki. At least from what was publicly available. Some of these trials are open access, some are closed access, and I could not see the full version of them to see if their placebo group or their control group had sham Reiki or something like that. But let's take a look at them right now. So, why is it important to take a look at clinical trials? Because clinical trials, they usually can provide us with more robust information. And that's a problem because to therapies like Reiki, which are complementary and usually don't have a financial incentive for or sponsorship for large trials, the small sample size of the trials and methodological limitations in quality make it very difficult in most of the times to say anything with a lot of certainty. We're going to look, as the presentation goes on some newer publications that are a bit different. But this review of the literature right here from 2009 serves primarily to indicate that to that date, 2009, there was a serious limitation in the number of studies, in the sample size of the studies, and the methodological qualities, and that more trials with high quality and rigorous methodology were needed. Those trials happened over time. We're going to take a look at some of them. So, first of all, let's take a look at this study here on the left. So, this study here on the left took patients with cancer that were suffering from fatigue, and it investigated the effects of Reiki specifically on fatigue, some other things as well, but the main research question was the effects of Reiki on fatigue. Well, these were patients with cancer, and fatigue is a very common symptom or side effect of treatment during the history of people with cancer. And they separated these people in two groups. The first group was the group that received Reiki. So the participants in this group to receive Reiki for some days, then they had a period of 1 week without any treatment, then they received two more Reiki sessions, and finally 2 more weeks of no treatment, and then there was the rest condition of patients that did not receive any treatment. They were just instructed to rest. What did they found? They found that there was a significant improvement in fatigue when these patients were receiving Reiki. This study had a very small sample size. They had 13 individuals. They also find some benefits on reductions in tiredness, pain, and anxiety. But the main topic of this article is fatigue. This study here on the right investigated the effect of Reiki on patients receiving total knee arthroplasty. That's a very arduous, a very invasive procedure. So they had 43 patients, 23 received Reiki, 20 were the control group, and what they found was that there was a significant reduction in pain except when the patients were in the post-anesthesia care unit. This reduction in pain did not mean that they used less medication. There was not a statistically significant difference in pain medication use, but the patients who received Reiki reported less pain nonetheless, so this trial suggests a beneficial effect on pain. This trial here on the left investigated the effect of Reiki on blood pressure and alcohol consumptions in young adults in Mexico. So they had the experimental group who received Reiki and the control group. And what they observed was that there was a reduction in mean arterial pressure. Mean arterial pressure is derivative of both the systolic and diastolic blood pressure. We use a little formula to arrive at this number, but that means a reduction in blood pressure in simple terms, which is a good effect for people with hypertension. And there was a reduction in alcohol consumption of 21 sections of Reiki therapy. Here on the right, we have another study that investigated the effect of Reiki with music compared with music alone on people living with HIV. So, in this study, there was two groups. Both groups participated in a music group. One group was just a music group. The other group received Reiki as well. And what they observed was that the group that received both Reiki and music therapy had reduced stress, anxiety, and depression, suggesting then a beneficial effect. Here we have a similar study investigating the effect on fatigue and anxiety in patients on hemodialysis. We had 30 patients on both the Reiki and control group, and they observed that the group that received Reiki had reduced fatigue and anxiety. We also have here another study investigating the effect of Reiki on pain, fatigue, quality of life in adolescents with dysmenorrhea. Dysmenorrhea is pain on menstruation, usually very intense. So they had the Reiki group, they had the placebo group. There were 38 patients in the Reiki group and 37 patients in the placebo group, and Reiki was found to be effective on pain and fatigue in adolescents with dysmenorrhea. It did not reach enough effect to alter the quality of life, but they found a beneficial effect nonetheless. Here we have another trial with 24 people in the Reiki group, 24 people in the control group. They were investigating the effects of Reiki on menopausal symptoms, and they found that the application of Reiki reduced menopausal symptoms, including heat waves and urogenital complaints, usually urinary or sexual complaints, of women during menopause. Here on the right, we have a clinical trial that's very recent. It was published in 2024 that investigated the effect of Reiki on fatigue and sleep quality in individuals with multiple sclerosis. There were 60 people with multiple sclerosis, 30 in the control group, 30 who received Reiki. They measured fatigue using this scale, the Piper Fatigue Scale, and they measured sleep quality using this instrument, the Pittsburgh Sleep Quality Index. And it was found that Reiki significantly improved both fatigue and sleep quality in this trial. Here on the left, we had the trial of the effect of Reiki on women who had just received cesarean delivery, and they were mainly focused on pain, anxiety, and blood pressure and heart rate. So there were a total of 92 patients that were separated in either the Reiki group or the control group. The control group was just rest without specific treatment. And what they found was that the Reiki group had a significant difference in pain, anxiety, breathing rate, which is something that changes both when the person feels pain and when the person feels anxiety. There was also a significant difference in the two groups in the need of analgesics. The people in the Reiki group needed less analgesics and they were more spaced. They did not need them as frequently as the control group. Here on the right, we have a trial that investigated the effects of Reiki on mood and well-being on university students. They had some students with high depression or anxiety and half with low depression or anxiety. They were divided to the Reiki group or the non-Reiki control group. They received some Reiki sessions, and what they found was that the individuals who received Reiki had a progressive improvement in overall mood, and this effect was more pronounced in the high anxiety or depression, suggesting that the more the person is suffering or the more intense the emotional disturbance, the greater the effect of Reiki, based on the findings of this trial. Now we're going to take a look at clinical trials that have sham or a false Reiki as a control or placebo group. Why is it important, again, to have the Reiki group the sham Reiki group, and even a control group that receives neither of those two for comparison, because the effect of suggestion is very high. In this trial, for example, here on the left, there was a significant effect of both real Reiki and sham Reiki over the control group. That means we have to be very careful about this. So let's take a look here at this trial on the right. This trial here investigated the effect of Reiki on pain and vital signs to people who received cesarean section surgery, women who received cesarean section surgery. There were 3 groups: the Reiki group, the sham Reiki group, and the control groups. 45 patients in total divided in these 3 groups. And what did they found? Well, they found that the Reiki group had a very significant reduction of pain. This was just the reduction of pain in the Reiki group. It was not a comparison between groups. It was just the effect of reduction of pain from before the beginning of the treatment and after the last Reiki session. And when they compared the groups, they found that the Reiki group had a significantly smaller breathing rate and systolic blood pressure, meaning they were more relaxed, they had less pain. And the Reiki group also used fewer analgesics, and they did not them as frequently as the sham Reiki and control groups. This now is a scientific information that is more robust than the ones we have seen before, because it has the sham Reiki as a comparison, which lessens the placebo effect and isolates the true effect, the possible true effect of Reiki a lot more robustly. It's a small sample size, 45 patients, but it had positive findings nonetheless. This trial here on the left is one that is of personal interest to me. It concerned me because they investigated the effects of Reiki to reduce burnout symptoms among community mental health clinicians. So they separated them into groups, the one that received Reiki or the ones that received sham Reiki. And what they found was that there was a significant reduction in burnout symptoms in the Reiki group compared with the sham Reiki group. And the effects were more pronounced among single people. I really don't know more about that. The authors of the article tried to discuss this finding a bit more, but what the main finding of this trial was that overall Reiki was significantly better than sham Reiki. This trial here on the right investigated Reiki on anxiety, stress, and comfort of people before gastrointestinal endoscopy. So they had 159 patients. They were divided in 3 groups: Reiki, sham Reiki, and control. And they received Reiki before the endoscopy. And what they found was that when the Reiki group, when compared to the other groups, had a beneficial effect on stress, a reduction in anxiety, and an increase in patient comfort. Now here on the left we have a trial that investigated the effects of Reiki on heart rate, blood pressure, and body temperature and stress levels. They had 48 subjects, and they divided them in 3 groups: Reiki group, treatment group, the Reiki, that was the treatment group, sham treatment, sham Reiki, and no treatment, the control group. And they did not find any statistically significant difference between these 3 groups. In health studies, when we say statistically significant, we usually mean that the difference that was found had a chance of less than 5% of having been found at random, in very simple and resumed terms. So we have negative studies on Reiki. One possible thing that contributed to this is that the more groups you have, the bigger your sample size has to be. The more subjects you need to reduce the effect of random chance on the results of your trial. These trials make some calculations, use some probabilistic tools, and the bigger the number of subjects, the less random chance can mess with your results. So usually, more subjects tends to result in a trial that gives a more robust information. That's not always true, that's a general rule. But we're gonna repeat this topic about a study with a lot of groups and a relatively small sample size for that number of groups because it is a repeating pattern in some studies. Now let's take a look at this trial on the right. Here they investigated the effects on anxiety, fear, pain, and oxygen saturation of patients who were about to undergo abdominal surgery. And there were three groups: Reiki, sham Reiki, and control. And what they found was that the surgical fear, anxiety, and pain levels were decreased, and the oxygen saturation levels increased in the Reiki group compared to the other two groups. In this slide here, we're going to talk a little bit more about why we need to look at scientific evidence very carefully. Here we have two trials that investigated the effects of Reiki on patients with fibromyalgia. This trial on the left was published in 2023. This trial on the right in 2008. The trial on the left had 50 patients, 25 in the Reiki group, 25 in the sham Reiki group. The control group received sham Reiki. So here they say control, it's the sham Reiki group. And what they found was that there was a significant reduction in pain. There was also a significant reduction in anxiety, a significant benefit on physical function, energy, and mental health. And here they mention pain again. And some other measurements of quality of life. So here we had 50 patients, 25 in each group, with positive findings favoring Reiki. Let's take a look at this trial on the right. Here we have a trial with 100 patients, so that's a lot more, but they divided these patients in 4 groups. They had groups receiving either true Reiki or false Reiki, and they also had groups that received Reiki by direct touch and others that received Reiki by distant therapy, no touch. So they had 4 groups. And this trial did not find any positive effects of Reiki on these patients. The first thing that we have to consider in this case is that there is a large number of groups on this trial. Even if the sample size in this study on the right is double that of the study on the left, the more groups you have, the number of people you need increases very rapidly. That might be one of the factors that influenced this difference in results. But I selected these 2 trials just to illustrate how we can have 2 very different answers to the same questions, and we have to consider the methodology of each trial and each study and take things with a grain of salt. Here on the left you have a study of Reiki on the functional recovery in patients just after they had a stroke, so post-stroke rehabilitation. They had the true Reiki, sham Reiki, and a historical control. That means the patients that they were not following at that time, but they had the records of those patients and they served as comparison. And overall, they did not find any significant effects of Reiki on the functional recovery of these patients. When they looked a little deeper, they found a suggestion of possible benefits, but it's very limited, a very uncertain information, and they suggest more studies about the subject. Here on the right, we have a study that evaluated the effects of Reiki on the autonomic nervous system. So they have 45 subjects in 3 groups: Reiki, false Reiki, and the no treatment group, people who just rested in the quiet room. And what they found was that in the Reiki group, there was a significant reduction in heart rate and diastolic blood pressure compared to the other 2 groups, suggesting an effect on the autonomic nervous system. Again, he mentions this was a pilot study with a few subjects. The changes were not that big, they were relatively small, and they suggest larger, more rigorous studies about the subject. Here on the left, we have a very interesting study that evaluated the effectiveness of Reiki on the mechanical ventilation weaning of patients in the ICU. Mechanical ventilation is when the person is breathing with the help of the machine, usually via oral intubation or a tracheostomy, and eventually these patients need to breathe on their own again. And this transition is called weaning. It's a very delicate period. There is a chance of complications. So they divided the patient into 2 groups: the group that received true Reiki and the group that received false Reiki. Here in the placebo, they used a simulated technique, so they used the sham Reiki. And the main difference they found was that the group that received real Reiki had less agitation. They needed a lower dose of calming medications, particularly haloperidol. Now, as a side note, now I'm not talking as a doctor, I'm talking as a Reiki practitioner. Applying Reiki to a critical patient in an ICU is a very delicate situation. It's not forbidden. It's not that we consider as that Reiki can be a hazard to this patient, but due to some other philosophical or even spiritual, not religious, but spiritual aspects of Reiki, applying Reiki to people in this particular scenario is a very delicate situation. It's not forbidden, it can be done, but it has to be very calmly considered on a case-by-case study. That's it. Now, let's get back to the lecture. Speaking as a doctor again. Now we're going to take a look at this trial on the right. This was a trial that investigated the effect of Reiki on the stress level of caregivers of patients with cancer. It was not the stress level of the patients with cancer. It was on their caregivers. The caregivers of people with serious diseases, including cancer, dementia, those children with cerebral palsy, usually is a very arduous process, and many times the caregivers suffer a lot. So in this study, they have a total of 42 caregivers. They randomized those caregivers to either Reiki or sham Reiki, and what they found was that the caregiver strain index, a measurement of strain, stress, let's say, decreased in the group that received Reiki, suggesting a beneficial effect. They also mentioned that the effect on that the blood pressure reduced Both blood pressure and heart rate reduced before and after each session in the Reiki group, and overall all caregivers stated that they found the caring process less stressful after the Reiki session, and that some of their physical complaints had some improvement. Now let's talk about the reviews of literature. These are the types of study that they don't make an experiment with a group of individuals. They search the scientific literature, they gather a lot of studies, and try to arrive at a more robust conclusion, a more robust answer. Well, first of all, we have this review. It was a review published on BMJ, which is a very renowned journal, investigating Reiki for pain, anxiety, and quality of life. Specifically in patients in palliative care, and what they found was that there is evidence that Reiki therapy is useful for relieving pain, decreasing anxiety, depression, and improving quality of life in several conditions. They also mention many limitations of the studies, a small number of studies in palliative care, and many of them with small sample sizes, but they tend to show some positive effects of Reiki therapy for the end-of-life population, and they suggest continue the work in this area. Here we have another review of literature. This time it's a systematic review. Systematic review is, in lay terms, the strongest type of review, because they make a review of the literature, but they follow a very rigorous methodology to do so. They do that because they want to arrive at the most robust answer possible. That is a systematic review. It's one of the highest levels of evidence we can have on the scientific literature. They depend on the studies, so the systematic review's quality depends on the studies that make it up, but overall this systematic review investigated the effects of Reiki on healthcare, and what they found was that the results contribute to the potential beneficial role of Reiki in mental health care. And they also suggest more studies with broad samples, randomized controlled trials, and a more patterned protocol. So it's easier to compare different studies. If the protocols are too different, you can't compare different studies. Here we have another systematic review investigating the effects of Reiki on pain in patients with cancer. So, when they applied their methodology, 7 studies met the inclusion criteria. They summed a total of 572 patients with cancer. When you add up all the patients of these 7 studies, 6 of these studies used in-person Reiki, and another one of them used distant Reiki. We're going to talk a little bit more about distant Reiki at the end of the presentation. So, Reiki was found to reduce pain in 5 studies, and it was determined as not effective on 2 studies. Overall, the review concludes that a limited number of studies show that Reiki applied to patients with cancer has a positive effect on pain, and again suggests more studies with better methodological quality. This is a systematic review of bioenergy therapies. This publication did not study just Reiki specifically. It studied many different therapies, including therapeutic touch, polarity therapy, Reiki, and others. And about Reiki specifically, they overall did not find in their review any clearly positive effects favoring Reiki. They did not find in anxiety and depression, stress and mental suffering, fatigue, neurotoxicity and pain. This review was a review of trials in patients who were receiving treatments for cancer. Many of these treatments, as a side effect, as an adverse event, can be harmful to the nervous system, that is neurotoxicity. neurotoxicity in pain. There was no advantage of Reiki over control group in this review. And also they reviewed the adverse events of Reiki, and overall they did not find any side effects caused by Reiki. At least we can be reasonably sure that Reiki is a safe therapy. Now, here on the left, we have a paper with a very provocative title. Does Reiki benefit mental health symptoms above placebo? So, these researchers made a systematic review of trials that had placebo, that examined the effects of Reiki on treating symptoms of mental health. And what they observed is that the evidence to date suggests that Reiki consistently demonstrates a greater therapeutic effect over placebo for some symptoms of mental health, and that the evidence of this benefit is greater for clinically relevant levels of stress and depression. That is, the higher the intensity of the symptoms, the more pronounced the effect of Reiki tends to be by this review. Here on the right is a section of this review where they discuss some of the limitations of the literature. And they say that there are a lot of studies that have methodological limitations, and again that topic of the similarity between protocols. Each study uses a different methodology, a different number of sessions, of different durations, of different types, and it makes it very difficult to compare each one and pinpoint exactly the optimal regimen of Reiki for each condition. And now, not speaking as a doctor but as a Reiki practitioner, pinpointing exactly the number of sessions for people with a particular disease is very difficult because it's very individualized. Each person has a different set of circumstances, a different set of many factors that contribute to their current status, and it's very difficult to have a standardized approach to everyone. It's a very case-by-case thing. Now back to the presentation as a doctor. Now here we have another study with an even more provocative title. The title is Reiki is better than placebo and has broad potential as a complementary health therapy. So they made a review of the literature. They found 13 suitable studies. The studies that specifically had a control group that accounted for a placebo effect, usually with sham Reiki. Of 13 studies they included in their review, 8 demonstrated Reiki being more effective than placebo, 4 found no difference but had questionable statistical resolving power. They had methodological limitations that put in question the information they provide, and only 1 provided clear evidence of Reiki not providing benefits. And when viewed collectively, these studies provide a reasonably strong support for Reiki being more effective than placebo. Here is an excerpt of this same paper, and it says, Reiki is a safe, gentle, and profoundly relaxing healing modality that can be practiced by anyone who has received an attunement from a Reiki master. Now on this next line here, Reiki is better than placebo in activating the parasympathetic nervous system, as measured by reduced heart rate, reduced blood pressure, and increased heart rate variability. Heart rate variability is a very interesting factor that can give us a lot of information and food for thought on the current status of health of an individual on a wide range of situations. We're going to talk about this on further videos on this channel, but Here it shows that Reiki does provide benefit over placebo, and that Reiki can be practiced by anyone who has received an attunement from a Reiki master. We will talk a bit more about that, but there are already a few publications on the literature that suggests that it might be reasonable for people to be initiated in Reiki and apply Reiki in themselves. Self-application of Reiki is the cornerstone of the practice of Reiki for the practitioner. It is highly recommended for the practitioner to self-apply Reiki every day, and it can be of benefit for people. It is a suggestion from some publications. We're going to take a look at that a little bit later on. Now, we're going to talk a little bit about distant Reiki. If in-person Reiki was provocative, distant Reiki is a lot more. So, by distant Reiki, we mean that the practitioner and the patient are in different locations. They're not in the same physical space. Well, here on the left, we have a study that studied the effect of distant Reiki on 25 individuals. This is a case series that was not a placebo or a control group, and overall they demonstrated a reduction in perceived distress and anxiety. Now let's take a look at this study here on the right. Here they reported the effects of Reiki on 25 individuals with extremity amputation. And these individuals received distant Reiki, and overall there was a significant difference in the levels of pain and also a difference in holistic well-being scale scores. Overall, it was determined that the distant Reiki sessions for 10 days reduced the levels of pain and overall improved their holistic well-being. It had a sample size of 25 individuals, no placebo and no control group. It was just a case series. Now, we have this trial here on the left that investigated the effect of distant Reiki on pain, anxiety, and fatigue in oncology patients in Turkey. They had a Reiki group and a control group. The people on the control group did not have a placebo. However, the participants did not know in which group they were in, because it was distant Reiki, so it was possible to hide that from them. So the participants did not know which group they were in. They did not know if they received distant Reiki or not. And overall, what was found was that the control group had higher levels of pain, stress, and fatigue. And of course, the Reiki group had reduced pain, reduced stress, and reduced fatigue. Now let's take a look at this trial here on the right. Here they had two groups. They had a group that received no intervention, 32 people, and a group that received distant Reiki, 30 people. And overall, what they found was that there was a significant reduction in the feeling of helplessness. There is also an increase in optimism. There's a reduction in fatigue, and an increase in the perception of having energy to do their things. This trial here on the left was a trial that investigated distant Reiki on the pain in women after elective cesarean section surgery. They had no placebo on the two control groups, but again, the patients did not know in which group they were in, so they did not know if they received distant Reiki or not. And overall, they did not find any significant difference between the two groups. Particularly, there was no difference in pain, no difference in the need for opioids for pain. There was a small difference in heart rate and blood pressure, but it was numerically it was statistically significant, but clinically it was of small importance. And in this trial, the distant Reiki was not found to be effective. Now let's take a look at this study here on the right. This study was a systematic review of Reiki in general, so they had a lot of trials of Reiki, and they had one trial of distant Reiki, which had a beneficial effect on helplessness and stress. So, let's talk a little bit about perspectives on the literature. First of all, the mechanisms of Reiki and distance Reiki. As more studies are being done on Reiki, both in person, local, and distant, we could have these studies, as they investigate the mechanisms behind the functioning of Reiki and if even distant Reiki, it could represent a practical application of concepts that nowadays are much restricted to experimental or theoretical physics at the moment. Another point of perspective in the literature is the diffusion of Reiki. As more providers, institutes, and people in general explore the practice, more experiences and more studies should be available, which should give us more clear data and clearer data, more data, clearer answers. And another thing that the literature puts forward is the perspective of large-scale self-application of Reiki. It's already been proposed that people being trained in Reiki could provide large-scale benefits, particularly by self-application. So people would be independent of a Reiki practitioner. Of course, they need a Reiki master to be trained in Reiki, but overall, maybe training people in Reiki in large scale could provide significant benefits. This publication right here is one that puts that idea forward. One curious thing that happened is when I was researching the papers for this publication, I made a search in PubMed. PubMed is the repository, the archive that holds many articles and papers, so when we want to look something up about health, we usually start our search there. And when I did the search for Reiki in the beginning of the month of July of 2024, there were 3,640 results. As I was finishing up this lecture, I searched it again and there were 8 more results. So I took a look at what was new. Some of the results were not particularly related to Reiki, but some were very interesting. Here is one of them. It was a systematic review of the effect of Reiki on fatigue symptoms of patients with cancer, and overall, what they found was that Reiki applied to cancer patients reduced fatigue while being effective in pain and stress alleviation and improvement in quality of life. There was also this systematic review with meta-analysis in the BMC Palliative Care, a very recent publication. Of course, they were all very recent publications, but they had a meta-analysis. What is a meta-analysis? Meta-analysis is usually done in systematic reviews. That means they made a review of the literature with a very rigorous methodology, and when they have a number of studies that are sufficiently similar in methodology to be mathematically compared, they can do a meta-analysis. Meta-analysis is a type of mathematical statistical comparison. This was done in this study. So they made a review of the literature. They included studies that summed a total of 824 patients, so a large number of people, and overall, Reiki therapy was found to have a significant effect on anxiety. Two very interesting things of this study were these. First of all, let's take a look up here, figure 3. This was the risk of bias of the studies. What is a risk of bias? the studies, depending on how their protocols are, how things are done, how things are being measured, the context of the people involved, how they got there, how they're contacted, how they're being measured. Some of these factors can influence the result of the study. The smaller the risk of bias, the better. The more we can trust the information of the study. And overall, the studies included in this review had a low risk of bias. See, we can see that by these green bars right here. So that means they were studies of good methodological qualities. And here on figure 4, we have the meta-analysis with a forest plot. Forest plot is the name of this type of figure right here. And here we have this diamond and we have this vertical line. When the diamond is completely to one of the sides of this vertical line, that means that when you consider all the information of these studies right here, we have a statistically significant result. In this case, favoring Reiki. If it were completely on the other side, it was completely favoring placebo, suggesting that Reiki could even be harmful in some way. But in this case, it is completely to the left of the line, meaning a benefit of Reiki with statistical significance. So let's sum everything up. First of all, evidence of the effect of Reiki. There are convincing evidences of the physical effects of Reiki, especially in preclinical studies, and there is strong evidence of the benefits of Reiki in human health, particularly in mental health, in the mental health domain. Some of the limitations. It's hard to pinpoint exactly the benefits, the size of the effects, the obstacle regimens of Reiki sessions based on scientific studies, due to differences in methodology, and that many of these studies have relatively small samples. Now, a personal opinion, as I was looking up these studies, and in part as a Reiki practitioner, keep that in mind. Many studies did not find conclusive answers to their main research questions. However, other effects or other benefits might have happened, but they weren't measured, they weren't captured, they weren't assessed. When we make a scientific research, we have our main research question, and the entire study is pointed to answer that question. The more we deviate from that question, the greater the chance that the answer we find is not robust, it could be a mistake. So we usually put a lot of value on the main research question, the main research finding. And as the research is geared to look at that particular aspect, if there is a benefit in other aspects, they might not be captured, they might not be perceived. And my final messages at the end of these lectures are, first of all, Reiki is not a panacea. Reiki does not solve all the issues. Reiki is not to substitute standard healthcare. It's not to substitute standard psychotherapy, but it can be of benefit. It is to be added to the health, to the therapeutic plan of the individuals. Reiki is safe, accessible, simple, both to implement and to receive, because it does not depend on a lot of external technology. It's a person-to-person thing. And again, Reiki should be used along with other therapies and methods of care. The main risk, in brackets, of Reiki is of people abandoning the standard therapies and using only alternative therapies, Reiki and others. Reiki is not to be used alone, but it can be very helpful for your therapeutic plan. That was it. I hope it was enriching. Thank you very much, and I'll see you in the next time.